colleague Varun really to share his thoughts in his opening remarks. Varun.
Good afternoon, everyone. So, first of all, Anupam, thanks for the invite. And thanks for keeping me on the radar while I was away from the country for such a long time. In fact, when Anupam invited me, I was wondering what is it that I should be doing now? And I thought this will be a good refresher for me as to what's happened in the Indian healthcare landscape over the last 7 years while I was away. So it seems while I was away, India has done a lot. And we've heard since morning in terms of the progress that has happened. And honestly, some of the problems that we used to discuss 7 years back, while I was a member of the FICCI HEAL, there's a lot of progress and development. And I'm going to capture some of that. And apart from that, one major thing that's happened, FICCI HEAL's become bigger. It's moved from a much smaller conference room to a much, much larger conference room. So it's honestly great to see that the platform's getting better. You know, a lot of what will be said today and tomorrow will be similar. So I was wondering as to how I can make it a bit more unique for you. So I'll give you a context of Indonesia in every statement that I make. And for those of you who don't know Indonesia, Indonesia is about 1/4 the population of this country, similar GDP per capita. So a comparison may just be in order. Because if I start comparing to the developed nations, it doesn't really come out nice. You know, comparing Indian healthcare to US is never okay. So first of all, I would, Anupam, take the liberty of, and this liberty I'm taking because 7 years has taught me a lot in terms of how valuable doctors are in a society. And we take that for granted in India. And I'll tell you why. But for start, can I just ask everybody to put our hands together for the Indian doctors? You know, I lived in a country, Indonesia, where during COVID, it was a far bigger struggle than any media reported in India. And the media reporting in India was bad. That country produces 300 specialist doctors, mind you, 300 specialist doctors every year. That's it, period. And that country has a population of 280 million people. And given the contrast, what I heard today and now in this session, is that we've increased our MBBS seats to about 110,000 per year. We've increased our postgraduate seats to 54,000. In a stark comparison to the number that I just gave you, which is 300. So I think healthcare industry has a lot to thank the education system of India to start with. Otherwise, all of what I'm going to capture now, whether it is on funding, on infrastructure, won't have happened because what makes our industry is 3 elements. And people like me complicate it for you, so let me simplify it. It is called TTI, Talent, Technology, and Infrastructure. But the first piece of building this healthcare industry that we know today is really the talent piece of it. But I think there's a lot more to celebrate in India that's happened over the last decade or two. One, funding's got much better. You know, I knew in India 20 years back in healthcare, where we used to say there's a lot of need, we are 1 billion plus people, but the need does not become demand because there's hardly any money. And that money was both the private space, the private insurance, and what the government was spending. The total spend today on healthcare has actually gone to 3.5% of GDP. And mind you, this is in dollar spend significantly more than what it used to be 2 decades back. The other thing that burdens all of us is how much money is going out of pocket. This number, as recent as 2014, was 65% of our total spend used to be out of pocket. It's gone down to 40%. It's a significant improvement from where we were in a very short span of time. India has also identified, amongst multiple other things, that the insurance penetration is low. And today I also want to share that if you look at the total insured population by the private setup, that's also grown from 10%, less than 10% actually, of the population to about 17% now. And some of my colleagues in the insurance sector tell me, this is all set to grow to 25% of the country's population, which will be privately insured. And that's not a small number. That's almost 400 million people in this country getting a private insurance from in some way or the other. And this is apart from all the conversation that you've heard from Dr. Paul this morning, that about half the population of the country will get insured or will have a funding assurance in some way, form or manner. I think there's one more thing that doesn't seem to have gone well, and I don't think there are any prizes for guessing that. That's the disease burden. The disease burden in the country, NCDs contribute 60%. I'm told that every third Indian above the age of 30 is either diabetic, pre-diabetic, or hypertensive. And that doesn't look good. So while a lot of improvement on infrastructure, a lot of improvement on funding, but if this is the way the disease burden continues to grow, we'll always be chasing the disease and not really solving for it. I think one of the other pieces that India needs, while there is a lot of improvement that's happened, is our bed penetration is still 1.4. What is good, and Anupam did ask me to highlight that, what's good that this is a joint effort between the government and the private sector. If you look at what the private sector has done in the last 2 decades, 70% of the patient load today, tertiary care patient load, is handled by the private sector. And that's not an easy or a mean task. This is India. The other thing, I think that's also happened, we need to, I guess during these 2 days, we also need to understand what does the country need going forward. A lot to celebrate. Disease burden is constantly growing. But there's also an understanding that is required as to where do we need to be and what are the current perils that we need to solve for going forward. And I think the 4 or 5 things that come to my mind, if we need to be ahead of the curve, is one, wellness is being invested in but not understood. Right? Otherwise, we won't be 1 1/3 with the diseases that we just spoke about, contributing to the NCD. We need to make people understand what wellness is all about. Second, Dr. Paul alluded to this, and I think I want to build on it. Credibility. Credibility is a two-way street. Right? Ever since I've come back to India, and unfortunately I wasn't reading too much of newspapers when I was in Jakarta, but you open the newspaper and you see healthcare credibility coming out in a big way in the newspapers. And by and large, it's never a compliment. Now, when you look at that, you start to wonder, is the spirit okay of the news and the capture that happens? I think we need to get that space a little more organized. I have to tell you that Indian healthcare is far, far, far superior to another country that you will see. And it's no mean task that almost 15% of the revenues of large private healthcare players are coming from international patients. And these patients come into India because Indian health outcomes are good. I think on the credibility side, and one request that I've always had, we need to document outcomes. That's critical. Credibility, I mean, how do you hold people accountable? There's no way of holding people accountable. And I think we haven't done enough. I know Dr. Vishnu Panigrahi has been a human who's been talking about this for the last decade or so. But clinical outcome reporting should become a norm if we need to really build credibility in our system. I think a lot's been spoken about affordability, but I want to add the other side of affordability as well. You know, India has taught the world frugality in healthcare. And many comparisons have been laid out on cost and price. And I think now that I've come back, I feel it's overdone. Let me give you a little bit of a sense. While I'm not saying that it's affordable for the masses, but to a limit, you can bring down the cost. And beyond that limit, you will start to compromise quality. So it's a decision we need to take on how much cost to cut down further. You know, I mentioned TTI, Talent Technology Infrastructure. Talent is the same in the world. Technology, 60% is acquired globally. And the cost of infrastructure, I'm in the business of setting up hospitals. I just realized that the cost of infrastructure in India, in tier 1 and tier 2 cities, I mean, it's impossible to buy a plot of land today in Bombay, build a hospital, and say it'll be profitable in the next 3 decades. It's impossible, right? So I think somewhere we need to understand the input cost that we have today in this country to build a quality healthcare system. And if you're talking about building 1 million beds in the next 10 years, we'll need to understand this equation slightly better. One piece again, I'm taking a leaf again from Dr. Paul's talk in the morning, was technology. You know, I alluded to Indonesia. Indonesia doesn't have as many doctors as India has. And therefore, and if you've heard this old phrase, need is the mother of invention. The adoption of digital technology in healthcare in Indonesia is significantly better than what I've seen in India after coming back. And the simple reason is their adoption is faster because they don't have talent. So what are they left with? They're only left with technology to help them solve the healthcare problems of their country. And I think that is what we need to do. We need to have a single source of truth. I know the government has started a lot of initiatives, but it's important that we all understand that putting data onto a single platform and making it portable is the need of the country for us to be able to give credible, high-quality healthcare in a sustained manner in this country. So thank you, Anupam, and sorry if I took a little longer.
No, that's perfectly fine. Thank you so much for those remarks. And I think the comparison between countries was very valuable.